Well, hello, everyone, and welcome to another episode of The Pulse, where we talk to digital health experts, influencers, entrepreneurs, enthusiasts from all over the world, disrupting healthcare one conversation at a time. I'm your host, Dr. Maida Afan. I'm eager to get the conversation started with our guests, but just before that, a quick reminder to like our LinkedIn page, subscribe to our YouTube channel, and we're also on 6 different podcast channels, including Spotify and Google Podcast. So today we have with us Zain Syed. He is a health systems expert in oncology, a design enthusiast, and calls himself a digital health nerd. Well, you're at the right place, Zain. Welcome to the podcast.
Thank you for the introduction. I'm glad to have a good discussion.
So tell me a little bit about your background. I know that you come a little bit, you have sort of a pharma background and expertise in oncology as well, and you ventured out into digital health. So sort of walk me through your career trajectory.
So I'm a pharmacist by training. After I did pharmacy school, I did 1 year of residency. After residency, I really liked oncology, which was kind of funny because during school, I really didn't like it at all. But when I got into practice, I really loved it. So I was fortunate enough to find an oncology position. And then after that, I did that for 4 years. And then there was another position opening to start there was a new clinic opening. So I thought it was a cool way to kind of start something from the ground up. So I moved there. It was in the same hospital system. Then after that, just about 3 months ago, I took a new position at a different hospital system. We'll be still doing oncology, but it'll be more, I'm moving a little bit more away from the clinical side, trying to move towards more the digital health side as well. And then you mentioned that I had a little foray into the digital health world. About 7 years ago, I had a digital health startup. And basically my passion is being able to have patients control their own health records. And so that's what it was kind of being based around. So it was going to be a cloud-based health record for patients to use. Initially, it was going to start with medication reconciliation, and then kind of move from there, kind of build off that. And then it was going to have a telehealth and secure messaging component to it as well. So at that time, 7 years ago, healthcare is not where it is now. Telehealth wasn't a thing. I was kind of told it's not going to work. Telehealth is never going to work. You need to see your patients, and there's no need for it. It's funny to think of it now. And then also cloud, right? People didn't trust the cloud back then. So it's kind of funny not funny, but I'm glad it's moved, towards where people are more accepting in the healthcare field. But I was just obviously a little too early at that time. Unfortunately, it didn't work out for various different reasons, but I learned a lot during that process. So definitely wasn't a negative in any way.
Well, maybe at some point in the future, you could sort of think about it again, about your health tech idea. It sounds great. And before I ask you my next question, I'm just going to read a couple of lines that I found on your LinkedIn profile. So you say that I have seen the dark side of healthcare, the lack of access, financial struggles, and people falling through the cracks, all leading to worse outcomes and increased costs to the system. I have seen how technology can help automate and give you back your time. I have seen how technology can touch millions, even billions of people. That is what I bring to healthcare. And so that really touched me at an emotional level, and it's also based on facts. And so when I read about digital health advancements like digital therapeutics and how it's really meeting unmet needs, the unmet needs that you described, in your experience, how are you using digital therapeutics or digital health tools to help cancer patients?
Unfortunately, in my experience, we don't. The healthcare systems that are right now in America, so that's where I'm based. There was a huge push. Like they're still starting to adopt them, right? So we had, for example, in my practice, when I was a pharmacist in my old hospital, we would do telemedicine per se, right? We would, if a patient was started on oral oncology medications, we would call them a week after they started, and then every other week for the first month, and then we would call them monthly. But if they needed to be called earlier than that, we would definitely do it, right, based on how they were feeling, what side effects they were getting. So it wasn't like digital health. It's not exactly what we think is digital health, like the sexy things. But that's a form of digital health. That's telehealth, right? So that's what we were doing, and we found that a lot of patients liked it. They loved it, because what problem with healthcare, at least in this country, is, and it's not because healthcare providers don't care. We do care. We want to do it, but it's just we don't have time to do it. And we're just so inundated with all this all these administrative tasks that we can't even do, like patient care. But like, patients loved it. We were able to make interventions on those phone calls, right? A lot of times, at least in the oncology population, actually in a lot of in a lot of populations in general, patients think that they're bothering us. And that really always hurts me whenever I hear patients say that, because there's something about our healthcare system that makes patients feel like they're going to bother us by calling us when they have an issue. And that always sits, it doesn't sit well with me. But anyways, when we were calling these patients, they were so happy. They're like, yeah, thank you for calling. I mean, some of them wouldn't say anything, but we had most of them would be happy that we called and checking in, even if they had nothing to report to us. So yeah, that's one way we used. And obviously during COVID, a lot of telemedicine visits were done. So we used a software called Doximity.
Yeah.
And one thing that I think a lot of people found out was, one big thing was like, oh, older people won't be able to use technology, blah this, blah that. And I think COVID showed that if you create a seamless experience with using good products, they'll be able to do it, right? You just can't make it complicated, right?
Yeah.
Don't make it complicated like the EMR is and stuff. And we found that a lot of patients were doing it, and a lot of patients preferred it. We were dealing with a really frail population that sometimes can't drive, doesn't have access to a car, or they can't get to their appointments on the time. So, they were in the comfort of their home. They didn't have to worry about any of that. Those stresses were gone from their caregivers as well. So, I mean, to me, it was great to see. And it was great to see, but it was sad to say that it took this long to get to that point.
And so when you say that, and this is the digital health paradox kind of, because when you say that doctors just don't have time, and digital health experts say all the time, well, that's what it does. It gives you time because it automates a lot of the stuff that you have to do, a lot of the paperwork, a lot of the administrative stuff. So it's kind of like both statements are contradicting each other. And I just think it's about time that providers use it, actually experience it. And then I think that we'll get to a point where you can actually identify the gaps, identify the opportunity areas, and make it better for both patient and provider.
Yeah, no, 100%. And I think a lot of the issues right now with digital health right now is you have a lot of companies that don't have clinical founders or clinicians part of their thing. So there's in healthcare, there's a written workflow, right? Patient comes in, does all this stuff, right? But then there's the real workflow that we actually follow, right? And like the real workflow is only known by clinicians. I mean, this is not like trying to be a gatekeeper or anything, but there's things that we have to do to work around the systems that were created, right? And they don't, and in healthcare, we don't have they're not APIs that seamlessly transition into different things, right? There's some sort of gate clock because of HIPAA regulations or just companies just blocking, just to protect their own IP. And healthcare is very slow moving. So I think that's the biggest problem in digital health and healthcare is that you have all these great products, but they don't seamlessly work into our workflow. So my thing is, like, if you're creating a digital health company, you want to make a solution that the provider doesn't even know exists, right? It's helping them, but they just don't know it exists. They can seamlessly kind of work through their workflow. But when you are asking a provider who's already double booked all day and is like half an hour behind to log into 4 different apps to see something, it's just not going to happen. You're just asking for a disaster. And that's kind of what's happening in the digital health world right now.
Right. No, I totally get that. And I think I couldn't have said it better, actually. But when we're talking about digital adoption, you mentioned some of the deterrents or the resistance factors. I wanted to elaborate on that in actual experience. Like, for instance, when I talk to digital health experts or people who are trying to enforce this change in digital transformation, there's a common feedback that I receive is that the older physician or older clinician cohort is one of the major sort of cohorts that push back and are resistant to change. Besides that, in your experience, because I want to know like real world insights from you, what do you think that some of the major deterrents are?
so in healthcare and like anything else, people just don't like to change, right? They just don't like to change, and you're never gonna make everyone happy. So that's the one thing. And like to me, like the biggest problem with at least healthcare, right, digital health, is changes are brought down without any, like, a lot of input from clinical staff, things like that. So you're already starting on the back foot, right? You're already trying to shove something down somebody's throat that's been doing it for 30, 40, 50 years. And then on top of that, it's super complicated, right? Like I said, like if you're asking them to uh, log into 4 different things just to take care of their one patient, they're going to be pissed off because they're, like I said, they're already double booked. They're already 45 minutes late. Their patients are angry. The nursing staff is busy. They're calling people. You're getting like 100, you're getting like the phone is ringing off the hook in the clinics. I don't think people, I think we as healthcare providers don't paint a good enough picture of our daily struggles,
Right.
because what I told somebody is like, we don't want to show up like to a patient all like frantic and, oh my God, all this is happening, because they're the ones going through the illness, not us, right? We're dealing with operational issues. They're dealing with actual healthcare issues, right? But I think we also do ourselves a disservice because we don't let people in to what we're dealing with. And
Right.
I think that it doesn't help the non-clinical founders because they don't really know. They just see like the outside from the patient side. And maybe if we did let more people in and understand, like, hey, this is all the stuff we're dealing with when we're just dealing with one patient. This is why we're half an hour late. This is why we're 45 minutes late. We had
Yeah.
a direct admit to the emergency room to the hospital, and that took an hour of our time because we're trying to get all that figured out. So I mean, there's just so much going on in the back end. So I mean, I don't blame some people for pushing back because you have all these solutions that don't integrate with the clinical workflow,
Yeah.
and
Yeah.
it's kind of like you're trying to drive a car without a steering wheel. Like that's sometimes how it feels from
Yeah.
our end. Like,
Yeah.
like you're given these amazing tools, you have an amazing car, but you
There's
don't
no
have the basic,
interoperability. Yeah. No,
yeah,
I
you don't
think
have the
it's
basic
a
functionality.
great way to describe it. And that just, it highlights 2 points for me though. Number one, the importance of training healthcare providers to use these digital health tools, and also the patients, and especially in the context of oncology, when we're talking about terminally ill patients, the caregivers as well. I think it's so important to train and to have training initiatives for these different sort of groups of people that are involved in caregiving and care receiving. What are your thoughts on that? How important, where do you think that we train enough or at
So
all?
I mean, I think that right now there definitely is a lack of training. I think it's really hard to corral so many different people depending on the health system. If you're dealing with a big health system, right, you're trying to roll this thing out. It's really hard, right? You get an email, you got to go in this learning module. Sometimes you don't have time. There's people like trickling in back and forth. Um, Training definitely needs to be fixed for sure. There's definitely, because when you have a great solution, if you're using it wrong, it's not a great solution anymore, right? You're not using it the way it's intended, right? But then you're also kind of circling back from the UI UX side, like, okay, if some people are all using it the wrong way, how did we mess up, right? And then from the patient side, I honestly think that if you're thinking that you need to train patients to take care of themselves, you've already lost the battle. Like honestly, you just lost the battle because I've I've had conversations with patients asking for very simple things, and this is nothing against them, but you can't expect them to be already, well, especially in the oncology world, right? They're already stressed out about their cancer. They're getting all these cytotoxic agents that are making them feel like crap all the time, and then on top of that, you're like, hey, why don't you try this app and learn it, right? And it's like the last thing they want to do. So I think if you're a digital health founder, you should not go in with the sense like, oh, we can just train the patient. No, you're not going to train the patient. Make the app or website or whatever you're making familiar to them, something they've already used. I mean, that's why like a lot of things look the same, right? And that way it's just intuitive, so where they can just use it. They shouldn't have to be trained on it, right? Outside of maybe like if it's a medical device, like, okay, this is how this is how you clean it, this is how you put it on, this is how you take it off,
Yeah.
this is when to use it. Outside of that kind of stuff, I mean, it shouldn't be anything more than that.
So interesting. And I'm so glad that you brought up that UI UX point. I love the direction that the discussion is headed in, because I have been reading about it. I've been talking to designers as well who are in the health tech space. And so if your UI UX, it doesn't, or if your design of the health system doesn't coincide with the patient experience, I think that's where it actually impacts the lives of the patients. And like you said, it should be user intuitive. And talking in the context of oncology, I think these patients are already so distraught. They're very anxious. They're very, the last thing they want to do is apply more effort on something that doesn't come naturally to them. How do you, as a design enthusiast yourself, what would you say to to people in this space, and to make patient-friendly designs?
I think just strip out all of the, I mean, like I love, like, I mean, I understand, right? Like I try to create my startup. Like one of the hardest things is to strip things away, right? Make it simple, right? Because you want to make it amazing. You want to make people like, you want that. It's almost like you're kind of doing it for yourself, right? You kind of have to take yourself out of the equation. Like, for example, like, if you're making like a chat bot or something, right? Just make it an SMS. Like just send them an SMS. That's it. Like, everyone knows how to text. Everyone knows this. Like just make it a simple text. Like don't make it an add-on app. It's just texting it to their phone, right?
Yeah.
The reason why Doximity works so well is because you didn't necessarily need to download the app. You would just get sent a link. They could either click on it or, they would just get a text, right? That's why, so many people adopted it, and that's why it worked well. So like you need to know your audience. And so like that's what I would say. Just make it as simple as possible, make it as bare bones as possible, because once you start gaining that trust from the providers and the patients, then you can start adding on to it, right?
Yeah.
Then you can slowly start bringing in those features that you really are passionate about. But if you bring in all that stuff in the kitchen sink throwing at them, then they're just going to get confused and be like, yeah, I don't want to do this. Because most people don't want to download apps, right? Not everyone is like, I'm a weird outlier. I like trying out apps. I like trying to, my phone has like hundreds of apps. Most people aren't like me, right?
Mm-hmm.
And so we need to think of that way, like just strip it completely to the bare bones and just make it like I said, a seamless experience where they don't even have to think about like, oh, this is something else coming into my purview. It's just literally something that they deal with on a daily basis. I think that is like the best quote that I read one day is, good design is one that you don't know exists. So that's what I always try to strive towards. Like I want to create something that no one knows exists, but is making their life amazing.
Yeah. No, and this is the point that I discussed with one of my previous guests as well. Let's just focus on doing what we're good at, make it as simple as possible, instead of just adding layers and layers and layers to it and trying to make this big thing at once that has no benefit to the patients, and it makes them not only them but the providers frustrated as well. So definitely simplicity is the key. And another thing that you talked about as well, and I talk about all the time, is having clinicians at the forefront of health tech, and having clinicians at the forefront of digital, or clinicians or healthcare providers at the forefront of digital health, simply because the insights that you're giving, Zain, a non-healthcare professional would not be able to give. Again, in terms of the workflow, in terms of the complexities, in terms of your relationship and the patient engagement process that you have. How important do you think it is to advocate for that? What are your thoughts?
Yeah, no, I think it's extremely important. Like I think like if you have a clinician as part of your leadership team in the beginning, like we can theoretically save you hundreds of thousands, millions of dollars going down something that is just not going to work, right? We can like save time. If you have someone like a clinician on board, they can save you time, because they can be like, hey, this is not how it works in the real world. This is how it works, right? I've done it. I've worked through it. I know the problem. This is how you need to solve the problem, right? Because it's kind of like having an insider, right? Like but it just makes it easier for you, right? We always are looking at, like, oh, your CTO needs to be a developer, have some sort of, really strong developing thing. Your CEO needs to have run a company or something like that. Then why aren't they also, like, if you're a health tech company, why aren't you adding a clinician into the board who's actually done medicine?
Yeah.
Everyone's so focused on building the product, but are you building the right product? Are you solving a problem that even needs to be solved right now, right? I mean, it might be great. It looks great. It's amazing. But do we really need it? I don't know. And you won't know that until you actually go out and have somebody from there and from the beginning.
Yeah, and on the flip side, or at the other end of the spectrum, I think that business training should also be included within the academics, or within the trainings for health for clinicians or for healthcare providers. That is a major opportunity area that I think that people should work on, and just have like a business certification as part of as part of med school. Because even though, I mean, now for health tech, I know a lot of clinicians venturing out into health tech and starting their own health tech ventures and health tech startups. But even then, even if it's not just health tech, they can run their own practices, they can, run their own clinics, and they should definitely have a business background as well. But that's another conversation for another day. And so, you're young, you're passionate, you are obviously in it for the change. You want to make change, you want to make people's lives better. And so just before we wrap up, I want to know what advice you would give to younger people that want to venture into digital health.
I think I think the thing that I learned is just, start reaching out to people early, right? And then seeing what's out there. I think one thing that I wish schools did more of was give students, let them know like what exists, right? Like if I knew back in pharmacy school, data science was a thing, and like AI, ML, like I could go into that as a pharmacist.
Yeah.
I would 100% have put all my eggs in that basket and gone down that road, because this has been like a thing that I've loved. I just didn't even know I could do it, right?
Yeah.
I think like I would tell students to just go out there and see what is out there in healthcare, not just in your specific field, if you're in medicine, pharmacy, physical therapy, whatever. Just see what's out there, because you'll be surprised as to what kind of people like you are in different fields. And I think that we just do a disservice, because there's a lot of talent in these professions that are just shuttled into like 2 or 3 different things, right? In pharmacy, you're either ambulatory care, your hospital medicine, or your outpatient care, right? I mean, like retail, right? There's so much more out there. And honestly, it took me probably until like 3-4 years ago to figure out that people like me exist. Like I thought I was weird and that there was no one else out there like me. But that's when I started reaching out to people and finding people like me, that I was like, oh no, I'm not weird. It's just that I didn't know that you existed.
Yeah. And just having a place, having resources, having mentors and guides that can help you from early on. I think it just makes such a difference. Someone who has sort of changed career paths as well, I definitely I can value the importance of that. But thank you so much for your time, Zain. I really appreciate it. I love talking to you about oncology and the impact that digital health can have in this very, very important space. Thank you so much. I hope we can do this again soon.
Yeah, no, thank you so much for having me. I really appreciate it.